of our families, especially those who are just above the Medicaid eligibility levels. Everyone should have access to healthcare, regardless of their age, their race, or their zip code. Nearly 200,000 residents, or 5% of our friends and neighbors, lack health insurance altogether. And this year, we saw how critical healthcare is. This year, so many people had to take sick time as they got tested and treated for COVID 19, quarantined for an exposure, or to care for a loved one. But those who are not covered may have to forego seeing a doctor, making an appointment at a health center, or getting medication needed to get better. And just because the cost of seeking medical advice was too costly. So, to address this, Connecticut has implemented an innovative healthcare model to help close the gap of those without insurance, such as our COVID 19 testing and vaccination infrastructure, our health insurance marketplace, Access Health CT, which has become a national model. Today, we're going to hear about the new initiatives and proposals that will build on these efforts and strengthen Connecticut's standing as a leader in providing affordable, equitable, and accessible healthcare. We will also be introducing you to some new leaders who will be working with us to implement these important initiatives. And it is now my great pleasure to introduce Vicki Veltri, who is, sorry about that. It is my honor to introduce James Michael, the Access Health Connecticut CEO. James Michelle, sorry about that. It said Michael on one of my sheets. Apologies. James Michelle.
Good morning, Lieutenant Governor, and thank you very much for that very generous introduction. Again, I'm James Michelle, the CEO of Access Health Connecticut. I'm going to talk a little bit about the American Rescue Plan that our president just signed into law about 2 weeks ago. And more importantly, its impact on Connecticut residents, specifically Access Health customers and beyond. Our team at Access Health, we've been meeting with the federal government. We continue to meet with the federal government and other state-based marketplaces, our insurance carriers and other stakeholders, elected officials, and we are in the process of putting together a very strategic plan to execute starting May 1st, 2021. This allows me to share some of the things we know and others that are still being discussed. Expected impact from our preliminary analysis. We know that a substantial number of Access Health customers will see a significant decrease in their portion of premium. And thousands who were not previously able to receive financial help will now be eligible for financial assistance through Access Health. More specifically, we know, for example, when we look at the data, this is a very specific example, but it speaks greater in terms of benefit to overall Connecticut residents. We took a family of 3. They were at 500 of the federal poverty level, which is roughly about $104,000 a year. They're above that amount, which means they didn't qualify for any assistance at all. They had a bronze plan, and they were paying about $1,800 a month. With the implementation of the American Rescue Plan, what would happen then is that family would come in. They could shop now because some of the barriers to buying an exchange have been removed by the plan. Now they would qualify for enough subsidy where their premium would go down to 0 if they stayed in the same plan. Now we know on average, anyone that's 400% of the federal poverty level and above, they're going to save on average over $500 a month in premium dollars. That's over $6,000 a year to American families in that particular situation. We know on average, right now, there are about 17% of our customers pay no premium at all because they get enough subsidy to pay the entire premium. After the American Rescue Plan is implemented, that amount goes up to over 50% of most Connecticut residents who are on the exchange will have 0 premium plus the $1 or $2 they may have to pay because of some benefits that are not covered in the by the Affordable Care Act. This is assuming no changes at all. On average, households in Connecticut would save over $200 a month on average, given all of our customers. So right now, after over the next several months, we will be focused on 6 key groups. Number one, our current customers. But we've done the analysis. We know which ones would benefit most once the American Rescue Plan is implemented in our system. And currently, access of customers not receiving financial help, income over 400% of the FPL will qualify, because before the rescue plan, anyone at above that amount, they have not, even if they're just $1 above that threshold, they got nothing. That barrier has been removed. So anyone out there in Connecticut who currently have no insurance or underinsured, we encourage you to go to accesshealthct.com to see what you may be available for starting on May 1st. We need about a month to make the changes to our system so that Connecticut residents could start taking advantage of the American Rescue Plan. The uninsured and the underinsured residents of Connecticut, again, we encourage you to go into our system starting May 1st. The off-exchange customers, these are folks who currently may have insurance through 1 or 2 carriers in Connecticut. They didn't qualify for any subsidy. You may qualify now, but you could only get it through the exchange. So we encourage you, starting on May 1st, go to the exchange and see what's available for you. We're also going to do very targeted outreach for small business employees who may not have insurance or who may be underinsured. And again, we're going to encourage them to go to the exchange starting on May 1st to see what you qualify for. And also, we want to remind, the law also allows that customers, anyone who currently has COBRA, between now and between April 1st and September 30th, the federal government will pay your entire premium up until September 31st. We would encourage you, once that runs out September 31st, you go to the exchange starting on October 1st or before your insurance runs out to, again, see what you qualify for. I cannot overstate the magnitude of benefit, financial benefit to Connecticut residents when you go to the exchange, and that the ARP is going to do for Connecticut residents. Strongly encourage Connecticut residents, go to Access Health Connecticut CT starting May 1st, or you could call our call center as well. We will have brokers in our call center. We are staffing up our call center in anticipation of a volume of calls. We are working with our call center where we will have a number of additional customer service reps on the call center, as well as a number of agents in the call center to help individuals in Connecticut to make the right choice for themselves and their families. The number at Access Health, and it's on our website as well, 855-805-4325. Now, the reason that all these benefits are available all year long for all of 2021 and also all of 2022. But we need time to make changes to our system so that individuals, small businesses will be able to take advantage of the change. So we need about a month. That's why May 1st is when we're going to go live with this. We are working with all of our partners, 2 carriers and other partners of ours, other agencies, to make this happen for Connecticut residents. So I look forward to answering any questions you may have. But this is a huge win for Connecticut as it provides relief from a premium perspective to Connecticut residents. Thank you very much. Now, I would like to introduce at this point the new chair of Access Health Connecticut's Board of Directors, Charles Klippel. Charles has a number of years of experience working with Aetna at the senior level. So we look forward to Mr. Klippel joining Access Health's board and providing us leadership and guidance as we go through these very challenging times in the healthcare space throughout the country. Mr.
James,
yes.
Michelle,
Yes.
thank you.
I'm sorry.
For your leadership. It's important to note that as of January 20th, 2021, nearly 105,000 people had enrolled for coverage with Access Health CT, and to have coverage of 105,000 people is really important to our state. And we thank you so much for your leadership. And it's now my pleasure to introduce Charles Klippel. Access Health recently concluded a study in Connecticut on health disparities, and Charles Klippel's work, experience with Aetna as a senior VP and deputy general counsel of health, and his civic work is going to bring a fresh look to Access Health CT, and it's our great pleasure to introduce Charles Klippel. Charles, thanks for joining us.
Thank you so much, Lieutenant Governor. Thank you, James, for an undeserved introduction, but because I'm very much the new kid on the block. But I am very, very excited to take on this post. I think Lieutenant Governor said at her outset that this is the exchange here in Connecticut really has been a model, and it continues to be a model. It continues to be, I think, one of the most effective and well-run exchanges in the country. And much of that is to credit to the prior speaker, James Michelle, who has capably led it now for a number of years. And I think what's particularly exciting about it, beyond just the fact that there is now greater funding and therefore greater affordability for the participants on the exchange, is that by doing all the work they have done, by building the infrastructure and the backbone of the exchange, it now becomes a platform to take on broader issues for the state. And that includes particularly health equity, which is very much a topic across the entire state, but very important for the participants on the exchange. And this is a time when we need to bring that focus to bear right across the entire infrastructure of healthcare. So the insurance companies, my background, the health providers, but also the financiers, including the state financiers, to really put together a concerted effort to bring our talents, our data, our analytics, the power that we can mobilize together. And I think there's very few better positioned institutions to serve as that focal point than the exchange. So I'm very excited to be here. Thank you so much for the opportunity to introduce myself. I am delighted to join this team.
Great, thank you so much. Next, it's my pleasure to introduce our public health warrior, acting Commissioner Deidre Gifford. Commissioner, thanks for joining us.
Thank you, Lieutenant Governor, and James and Charles. Thank you for laying the groundwork. I'm here to add to the very exciting news about the expanded support for customers, new and existing customers on the exchange, by really emphasizing that access to healthcare coverage is one of the three legs of the stool, and the others are quality and cost. And included under quality is what Charles was talking about, is making sure that equity is a key focus. So if this pandemic has taught us anything, it's that we need to double down on our efforts on making sure that every resident of Connecticut has access to care, that care is affordable, and that it's of high quality. So the governor, just prior to the pandemic, had signed Executive Order number 6, which directed us at the Department of Social Services to establish a process for looking at quality and cost within the Husky program. We have that process underway, slightly delayed by an intervening pandemic, but I'm happy to say that that is work that, in collaboration with my colleague, Vicki Veltri, we are well under the way of accomplishing. And strengthening the Husky program by looking at new ways of paying for services like maternity care and nursing home care. And finally, really focusing on equity as part of our core mission and making sure that health outcomes and health access are equal for everyone who lives in the state of Connecticut. So I'm delighted that the American Rescue Plan is offering additional opportunities for coverage for people who don't receive Husky benefits, who don't qualify. And I look forward to working with Access Health and the governor on these important initiatives going forward. Thank you, Lieutenant Governor.
Thank you. And now it's my pleasure to introduce Vicki Veltri, who leads our Office of Healthcare Strategy. Vicki, thanks for joining us.
Thank you, Lieutenant Governor, and it's great to be here with all of my colleagues today. And I'm here to talk a little bit about the great value of the American Rescue Plan to our exchange and to our residents statewide. We think these premium subsidies are going to make a huge difference to people's access to health coverage. Is absolutely critical. But we know that health coverage goes part of the way, but we also know that we need to ensure people actually can go see providers and have real access to coverage. And that means sometimes they might need help beyond premiums, including cost sharing. And Governor put forward a bill, 6447, which we thank the Insurance Committee for bringing out of committee yesterday, that does two things to help people afford coverage. One is it provides some subsidies that could help people in things like cost sharing. So people may have coverage through these premium subsidies, but they may also need a little help affording those cost sharing things like co-pays and deductibles. The subsidies included in the governor's bill may go a long way to helping people actually turn coverage into care. We think that's critical. The other thing that governor's bill does, in addition to executive orders number 5 and 6 that Commissioner Gifford just mentioned, governor's bill actually tackles one of the underlying cost drivers in healthcare right straight on, and that is drug pricing. Drug pricing is becoming an issue to residents across the state. Many surveys indicate that consumers have very hard time affording their drug coverage. And 6447 really goes a long way to addressing what we're seeing, which is drug coverage becoming about 25% of the premium costs that people pay for their insurance. That's really important because we talk a lot about the need to bring down insurance costs, but what drives insurance costs for the most part are the underlying costs of care. That includes drug coverage, that includes hospital coverage, it includes outpatient coverage. But the governor's bill goes a long way towards tackling that. We propose partnering with other states to limit annual increases in drug prices to inflation plus 2%. This proposal is similar to other bipartisan efforts in other states. We think while we appreciate, obviously, the work of our drug companies, especially here in the state of Connecticut, we think this is a reasonable approach to addressing one of the leading cost drivers of insurance premiums. The other thing I'd like to talk a little bit about is going back to Executive Order number 5, attacking or looking at and examining and collaborating with our health industry sector is going to be critical if we're actually going to bring the cost of care down. Executive Order number 5, which is in its first year of implementation, establishes cost growth benchmarks across the state of Connecticut, across all of our payers and populations. Essentially what it does is say, we want costs to grow by a more reasonable rate of growth than they're actually growing. We recently released data that showed healthcare costs in the state of Connecticut were growing between 2015 and 2018 on an average rate of 4.9%. That exceeds inflation. It exceeds the growth of the economy. It exceeds the growth of income. We need to bring that rate of growth down. I'm happy to say we've been doing this work with bipartisan support for a couple of years now, and we appreciate that support. We also need to tackle, as I said earlier, cost sharing. Cost sharing has gone up out-of-pocket costs for people in the state of Connecticut by 26% between 2015 and 2018. Those two factors are a call to action, and it's why the executive order, executive number 5, and the work with Commissioner Gifford, as she mentioned earlier, is so critical to putting our state on a path of improving affordability in healthcare. So with that, I'll turn it back to the Lieutenant Governor.
Vicki, thank you so much for all of the work that you are doing to make healthcare more affordable and to prevent cost increases. It is now my pleasure to introduce our governor, who has taken some very positive steps forward in healthcare by putting forward legislation to increase access to healthcare and also to decrease and keep drug and prescription drug prices affordable. So Governor Lamont.
Hey, thanks, Susan. And, good morning, everybody. Just pick up where we left off. Connecticut has one of the great healthcare systems in the world. I think that's publicly recognized. We also know that we're one of the more expensive healthcare providers. We also know, especially after a year of COVID, we've been reminded of the incredible disparities in terms of healthcare. And these racial disparities are a healthcare crisis. And these are three pieces that we're trying to address here with this legislation. And I can't get any legislation passed without legislators. I'm really happy to see Matt Lesser and Kerry Wood here, who are chair people of the insurance committee. So we're going to be working very closely together in terms of what we got to do. Charlie, welcome aboard, by the way. And it's really nice to see everybody's fallen in love with the ACA and Obamacare again. It was a tough 10 years. Everybody's always trying to beat it up. And now we realize that it really works. And we realize that it's cut the number of uninsured in this state by half. And now we realize that we're doubling down. And as Vicki and James said, with these incredible subsidies coming out of the American Rescue Plan, it's going to be much more affordable for middle class people earning up to $100,000. Dramatic reductions in costs, up to $6,000 a year in terms of what they have to pay for insurance. That's a big deal, opening that up. But as Vicki said, look, you can have insurance and you still may find that your healthcare is unaffordable given the co-pays and the cost sharing and deductibles and all the other things they're doing. We're trying to make a start at that. We've got a plan in place, funded at about $50 million a year on a recurring basis to help out those individuals and reduce their co-pays and deductibles to make sure that not just you have insurance, but you can afford to use it and afford to get the health care you need. I think we've realized this with COVID again more than ever. Healthcare is not just a right for you. It's really important for all of us that you be able to afford the basic preventative healthcare. And that includes testing and vaccinations. That's for your health and that's for our health. And I just say that often in the political world, they lead with subsidies. And I appreciate what we've described here in terms of the important subsidies that are going to make Affordable Care Act and insurance more affordable. We've also been tough in holding down the rate of increase in insurance rates. Vicki mentioned what we got on the benchmarking system. Josh Hirschman and our guys from insurance are here. I think we had the lowest increase in health insurance rates in modern history over the last year. Look, COVID and electable, surgeries and a lot of things are reasons for that, but it's also that we're paying close attention to these costs. And I do believe that over time, we're going to have more successes there as well. I just think the transparency and showing what those increases are and holding people accountable, Vicki, is going to make an enormous difference. And you've been taking the lead there. And we got to deal with not just the symptoms of healthcare, but also you have to deal with the underlying cost drivers. And you heard mentioned, the high cost of pharmaceuticals, generic and others. And we're working with Charlie Baker up in Massachusetts to put in place a cap on the increase in pharma costs. And as Vicki said, that represents, somewhere in the order of 20-25% of overall costs. We're dealing with that, going to hold those down, make that more affordable for you. Matt took the lead on insulin, making sure that's affordable and nobody's denied on that in terms of life-saving things that we can do. I don't see Kevin Lembo here, but over in the controller's office, Kevin's been really taking the lead on hospitalization and costs and driving people to centers of excellence, using incentives so that you go to places where you have not just lower costs, but higher quality. And we give you incentives to do that. Deirdre is doing the same thing over at Public Health and Department of Social Services, making a big effort in terms of maternity care and making sure we pay for value-based care there. We have a lot of work to do. 40% of our folks. I think you said that, Deirdre, born in Connecticut, under Medicare, under Husky, and I'm going to make sure they get the very best value we can. Deirdre's also working hard in nursing homes, going through a transition right now, making sure that we are paying for quality there. And finally, let me just end, where I started, which is equity. And what that means in terms of what we're doing in terms of vaccines, taking that to the community. We've got to do the same thing with healthcare. We got to make sure that not only do people know they're eligible for Husky, but we make sure that they actually get their a primary care physician, get their contact, get their federally qualified health center, reach out and make sure people have healthcare, can use it. We've got a lot of support from the American Rescue Plan. For me, one of the things we're looking at is what we do with our schools and community-based healthcare in our schools, making sure that we can expand the reach in a variety of different ways. But I just want to, end, where I started, that Connecticut is taking the lead. We have the best hospitals, great insurance companies, and PBMs, but we got to drive in the same direction to hold down costs, make it more affordable for our families, make it more affordable for our small businesses, adding options on the exchange, reducing costs, and emphasizing quality. And with the team you see here, and now with Charlie taking the lead as chairman at the exchange, we're just getting started. Thank you.
Thank you so much, Governor. So you have been hearing our healthcare leaders discuss the American Rescue Plan and how it's going to provide subsidies and help to those who are struggling to afford health insurance under the ACA. But we're also here to celebrate, in addition to the American Rescue Plan, we're here to celebrate a significant milestone in moving important healthcare legislation that the governor has put forward, and that is House Bill 6447, which does a lot to help keep drug prices under control and also to expand access to healthcare. And we're very honored to have our two insurance leaders here with us. And we're going to first hear from Senator Lesser. Senator, thank you so much for your leadership and for helping us move House Bill 6447 forward.
Thank you, Lieutenant Governor, and thank you as well to Governor Lamont. It's good to see so many folks here. And yes, that's correct. About a week ago, I saw Governor Lamont in Middletown, and he asked me if we could be able to move that bill out of committee. And at the time, it looked hit or miss, but we were able yesterday with bipartisan support to move it forward. And, I know that there are a number of ideas that are currently moving through the legislature, from the legislature and from the governor about ways that we can strengthen healthcare. I think we can get to yes on them, but I think it is important to underscore that this is the year for health reform. We are met today. This is the 11th anniversary today of the passage of the Affordable Care Act. And the American Rescue Plan is the biggest improvement to healthcare, to health insurance since passage of the Affordable Care Act. And that's important. A lot of good is happening. A lot of good is going to happen with Mr. Klippel as chair of the board and working in partnership together. But we are in a healthcare crisis, as you all know. We are in a health insurance crisis, and we are in a health equity crisis. And that's why we're excited to get to work with all of you to make sure that Connecticut is leading the country in bringing down costs and expanding access to healthcare and in tackling the specific crisis of health equity that we've seen during the pandemic. So I'm excited to get to work. I know there's a lot more work to do, and I'm hoping we can pass landmark health insurance reforms this year to make sure that healthcare is a right and not a privilege.
Thank you so much, Senator. And it's now my turn to State Representative Carrie Wood, who co-chairs the Insurance Committee. Carrie, thanks for joining us.
Hi, good morning. Thank you for having me. I think everyone really hit the nail on the head with how this is a team effort. It is not just benchmarking. It is not just insurance. It is not just cost of care. It is not just support from the federal government, but it is all of us working together to drive costs down and to provide better, affordable, quality insurance. And that's what we've been working very hard on this session. People that have insurance, people that are small business owners, there are huge gaps in our existing healthcare market. And many of the bills that came out of the Insurance and Real Estate Committee this session are addressing that. And in addition, the the American Rescue Plan has just done wonders here for Connecticut's exchange. And I want to thank Commissioner Michelle and his team for educating us all last week. I've set up many meetings to make sure that that message did get through to our committee members. It is just such great news to share. And anyone out there that has insurance that feels that their costs are very high or is running a small business, that 15 under market, now is the time to look at the exchange and get on board for some quality, affordable health insurance. I look forward to working with everyone on this committee. And congratulations, Mr. Klippel. I look forward to working with you. Thank you.
Thank you so much, Madam State Representative. And with that, we will go to questions from our media partners. And Rob, do you want to call on folks?
Sure. Thank you, Lieutenant Governor. We'll start with the Hartford Courant. All right, moving on to News 12.
Hi, everyone. So, Governor, since Kerry Wood and Matt Lester are on the call, I'll ask you what your position on the public option bill is, and also specifically some of the changes that the committee made recently.
I'm still taking a look at that, John. As you know, I'm pretty reluctant to have taxpayers underwrite any of the risk here. And what I really tried to focus on is the underlying costs of healthcare, how we can bring that down. But look, the legislature and Matt and Kerry are coming up with innovative ways we can also bring down the costs, and so I'm willing to take a look at that.
There was a pretty big fight in the committee last week, as our two legislative members know, in terms of whether it should be, fully funded. I don't know. Would that be a deal breaker for you? Do you need to see that in a bill to get behind it?
Look, I think there were some important changes made, but let me just wait and see, John. The bill's going through a couple of iterations. My big emphasis, as you know, is expanding accessibility. We're doing that with a lot of federal support over the exchange. Looking at the underlying costs we talked about, I think that's how you really drive fundamental reform over the long term.
And Governor, just one more slightly off-topic question. This afternoon, the independent living centers are going to hold a press conference. They're upset that your new budget slashes funding to them. They say, we help disabled people, live independent lives, and because of the pandemic, we've had to take on more clients, we've had to take on more work, more remote work. Was there some sort of rationale for cutting their funding this year?
I would just tell everybody to slow down a little bit. We've got significant federal resources. We're going to put an emphasis upon not-for-profits like them. And I think they're going to see significant funding over the next 2 years. Look, we need their help more than ever after a year of what we've been through.
So given, that you've got to create a spending plan that's going to go to the legislature now for the new American Rescue Plan money, are you saying that, part of that money you plan to commit to these independent living centers?
I think so. Let me get back to you on those specifics, but all I know is we're going to provide significant resources to a lot of the not-for-profits and independent living if they fall within that category. Deirdre, do you know any more on that?
No, Governor, I agree with the approach that you just described, which is that so many of our community partners have been essential to caring for our most vulnerable during the pandemic response. And we, together with the governor's office and OPM, are looking at all of the needs across the many, many providers who have been adversely impacted by the pandemic.
All right, thanks, everybody. That's all I have.
Thanks, John.
Thanks, John. Going back to the Hartford Current.
Thanks, I appreciate that. I'm sorry about that. Just a sort of insurance-related question, but not health insurance. If I could just ask, since both insurance chairs are here and the governor, the Hartford announced it rejected the offer from Chubb. Could you talk a little bit about your concerns about insurance companies being headquartered in the state, and whether you're, what your reaction is to this news, and if you think maybe it could come back again with another offer that the Hartford might actually agree in the future, and what your concerns are, if any, about Hartford, the city of Hartford as the insurance capital.
I'll start, and then I'd love to hear what Carrie and Matt have to say. This is the first step in a long dance. I feel very strongly that the Hartford belongs in Hartford, ironically enough. They've been a leader for going back hundreds of years. And so whatever interest there is from outsiders, it's an interest because the Hartford provides an amazing service and have been leaders for a long time. But I think at that point, just wait and see. You're going to see a variety of different dance steps over the course of the next weeks or even months.
I agree with what the governor just said. Obviously, paying a lot of attention to it and concerned. And I had some phone calls this morning just expressing our renewed commitment to do whatever we can to ensure that we are maintaining our strong insurance workforce in Hartford. And we'll continue to monitor the situation going forward. And if we need to do anything, we will certainly step forward and work together to find out what we can do to support our domestic insurance industry.
And I just want to reiterate that this is still the best place in the world for insurance and insurance related industry to do business. We have seen that with the growth in our captive insurance market. We have seen that in the growth of industry jobs, and I stand behind our commitment to make Hartford and keep Connecticut the best place for people to come into that industry and to grow this sector.
Thank you very much.
All right, thank you, Steve. Moving on to the Waterbury Republican American. All right, the Connecticut Mirror.
Good morning. I have a question if the chairs of insurance could weigh in, and also the governor. The public option bill and the governor's bill have differences between them, but they also have some overlap, including in the form of an assessment on the insurance carriers. Could you guys talk about the path forward for those measures, if you see some kind of combination of the two, or if there is more favor for one or the other, how that's going to be addressed?
Go ahead, Matt.
Well, I think we tend to not negotiate via press conference, but I'm obviously hoping that we can get to yes on the important issue of health insurance reform. I think there's a lot of important overlap, as you note, between the two bills. But I think we got to do a lot to address small business affordability and make sure that immigrants in the state can get access to health care. I think we can do, we should go big on this and deliver a big reform. And we'll have, I think, spirited and good faith conversations going forward about how best to do that. But I think the vote yesterday by the committee, I think, is hopefully a sign that we're willing to sit down, to engage, to get into the details of controlling costs and expanding coverage.
Yeah, I agree with that.
Sorry, go ahead, Governor.
Go ahead, Gary.
Sorry about that. Thank you. I would agree with my co-chair that it's going to take all of us to get to a point of what we finally put forward and vote on. But there are some really great pieces of both of these bills and many other bills that we voted out of committee yesterday that, we can now take hopefully the best of all of those and move something forward to the floor. But keeping in mind that we do have a lot of support from the American Rescue Plan right now, and making sure we're not duplicating services that were already given to us at that level. So a lot on our plate, and it's not something that I can say is I can't predict where we're going to be, but it's going to be a group effort for sure.
All right, thank you, Jenna. Moving on to WTIC. Connecticut News Junkie. Hearst Connecticut Media.
Thanks. I had a question. Multiple speakers mentioned the money from the rescue plan for premium subsidies. How is that sustained after the stimulus money runs out?
Good morning, James, Michelle. Again, the rescue plan addresses the subsidies for 2 years, for all of 2021 and all of 2022. After that, we're not sure what's going to happen, but we hope. As I tell my team all the time, hope is not a plan, but you should always have hope. We hope that the subsidies will be extended beyond 2022.
My hopeful plan is this goes way beyond 2022. It's the right thing to do. We're going to show we make it work. We're going to show what it does to make healthcare more affordable for everybody. And I think that's going to get continued. This is going to be baked into the cake.
Thanks. And then one other question for the governor or the two co-chairs. Are there aspects of the Republicans' healthcare plan released earlier this year that you guys would be interested in incorporating in either of your bills, like the importing prescription drugs from Canada, for example?
The reason first off, I don't know that that's a Republican idea. That was an idea that we had worked on together 2 years ago in 2019 that we had proposed. The reason we didn't move forward on it this year is because Canada passed a law prohibiting the re-export of drugs to the United States. So since it's not working for other states, we figured we would put that on the back burner. No philosophical problem with it. It's just a question of whether it will work. And it looked like it was going to work in 2019. Less so now, thanks to the actions by the Canadian government.
All right.
I'll also say that the Republican bill is much more expensive than either the governor's bill or Senate Bill 842, and they haven't figured out a way to pay for it, and so that's it's always a concern. How do you pay for it?
All right. Thanks, Julia. Moving on to the Associated Press. All right, NBC Connecticut. WTNH. Fox 61. Connecticut Public Radio.
Hi, everyone. This is a question probably for James and Michelle. I was wondering, when the May 1st date comes up and that some things are open to more people, will that be treated as a special enrollment period, especially for people who already have insurance and they're not going through a life qualifying event or things like that, just to be clear for people who are looking to change plans potentially?
Thank you for that question. Yes, it will be treated as a special enrollment period, and it'll be opened. We're not quite sure exactly when it's going to end yet. We're going to try to coordinate with the federal government. We've spoken with the federal government. They have not decided when they would close theirs off, so we try to coordinate with them. Yes, it will be treated as a special enrollment where anyone could come in and change their plans. There'll be some very specific requirements to be able to come in, but it'll be open to anyone in Connecticut who wants to come in and lower their cost for health insurance, or maybe buy something that covers more. And also, we are going to do a lot of marketing and outreach to make sure every Connecticut resident is aware of what's available to them and how to get the help that they need.
Great, thank you. And I think a couple people mentioned about the $200 200,000 people in Connecticut who are currently uninsured or underinsured. With some of these new options opening, of those people, who might be best, get a chance to benefit from the changes that are coming down, and who among those 200,000 are we still missing? Are some of the undocumented community counted in those 200,000 people who we know are not going to be eligible for some of the immediate changes, especially in relation to the American Rescue Plan?
Nicole, can I just say to your question that there are a lot of people amongst that 200,000 who do not realize that they qualify for the ACA program and may either be eligible for insurance for free, depending on their income, or on a sliding scale. And that's why our office has been working with Access Health CT to get that message out to people, because there are a lot of people who just don't realize that they already qualify or that it would be affordable to them.
No, thank you for adding that. And one of my other questions was, I know the American Rescue Plan gives states an option to extend postpartum coverage for women from 60 days to 12 months. I know Connecticut's current laws do go to 60 days for a certain percentage of the federal poverty level. I know there is a bill that is going through the legislature trying to do this. Is there any comments on will that bill be passed? What are the chances that that bill will be passed? And, how does the state see this helping, especially close gaps in some of the health disparities that we're seeing among women in birth rates and mortality rates?
I can take a stab at that, Governor. Yes, the recovery plan does provide a state option to extend care for postpartum women beyond the 60 days when they may lose coverage. They don't necessarily, but they may lose coverage because of their income qualifications. So we're looking at that. We in Connecticut are lucky because we overall have a fairly low uninsured rate, although we still have a ways to go, as everyone has been saying. There's not a large percentage of women in Connecticut who lose coverage after 60 days. It's probably less than 5% of the women who give birth. However, we do know that to reduce health equity disparities for postpartum women, that this 1 year of coverage is really critical. So we will be looking at that option, as well as whether these new subsidies on the exchange might be an option for helping women transition from Medicaid coverage to exchange coverage, if that's appropriate for them after they give birth. So there's a lot to explore and understand in the ARP with respect to this population, but we do agree it's a critical group to address.
Thank you. And if I may just add one more question, I know, I think Vicki was talking about this when we talk about expansion of coverage and people who may be eligible for not only Medicaid, but other plans under the ACA. She had also mentioned that people need the ability to actually go get care. And so I think, is this something that as we do expand either eligibility levels or types of plans that people can buy, how does Connecticut ensure that the providers out there's growth in providers who actually can take these people who have these plans and these coverages?
So I'm happy to take that. Thank you for the question. Yeah, my reference was to oftentimes people who have coverage, they can afford the premium, but they have a hard time affording cost sharing, which makes it hard for them to go see providers when it's absolutely necessary. So one of our goals is to look at the subsidies that the governor has proposed under 6447, the potential option of maybe targeting some of those subsidies to offsetting some of the cost sharing that people are facing. We don't want to see people in catastrophic kind of coverage plans when they need access to care for, let's say, chronic conditions and things like that. To your workforce question, excuse me, I think that's a really good question. And I think we have been examining that in the context of the benchmark work, especially on the primary care side, where we will face a shortage unless we do something to incentivize providers to become primary care providers, which means looking at different ways of structuring the care delivery system. So, and relieving some burdens on primary care providers and expanding primary care teams to include things like community health workers and nutritionists and pharmacists. Those are the kinds of creative things that we need to do in Connecticut that we're just starting to do, but we need to do to incentivize a workforce for the future. So I hope that addresses at least part of the question.
Yes, it does. I appreciate it. Thank you.
Welcome.
All right, and thank you. That was our last media outlet, and that should conclude our press conference for the morning.
Thanks, everyone.
Thanks, everybody. See you, Charlie.